The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live. I'm Shannon Penrod. We're webcasting to you live from the Center for Autism and Related Disorders headquarters in Tarzana, California. It is Wednesday. This is a very exciting day here, a show that you guys have been asking for a long time. In just a few minutes, I'm going to be joined by Dr. Doreen Granpeesheh, and we're going to devote this entire next hour to the subject of anxiety, including when we see OCD behaviors. So anxiety, the anxiety show. I'm anxious about the anxiety show. So that will be thrilling. You can be writing in your questions on the live feature right now. We have a little bit of business to take care of before we get to that. As you know, our holiday giveaway extravaganza is in full swing every hour of the show from now until December 20th. We are going to be giving something away. And this hour is no exception. We are going to be giving away a 6-month subscription to Skills for one child in this hour. How do you participate? You're watching the show, whether it's live or recorded, and sometime during this hour, Emily will put something on the screen, a word or a phrase on the bottom part of the screen. You'll need to take note of that, and you'll want to email us at the address that Emily is going to show you right now on the screen. And in the subject line, you're going to put the item that you want to win, and in this hour, it is the Skills subscription for 6 months for one child. And in the body of the email, you will put the word or phrase that appears on the screen. They must match, right? And then of the correct responses, we will choose the winner. And you must write that into us by 7 a.m. Pacific time tomorrow. Now, there was a technical glitch yesterday. So many of you were wanting to write in that it kind of shorted the system. And so yesterday's show did not actually, a recorded version of it did not appear on YouTube. So we're going to extend the gifts from yesterday. It is now there. Everything is repaired. You may go there, watch yesterday's show, and it's going to be there in a couple of hours. Forgive me. It's on its way. So probably shortly after this show ends, that show will be up, and you will have till 7 a.m. tomorrow to win the gifts that were featured yesterday as well. So it's kind of like a twofer day. And in the next hour, I can tell you that we are giving away a lovely, I have it right here, a Bop It. These are so much fun and really a great opportunity to work on fine motor skills. It can be a very social game. Kids can play with each other. Family can play together. My son is better at this than I am. Sometimes I get anxious playing this game because I can't quite do it. But it requires you to think and act fast, so working on fluency and those fine motor skills. Really remarkable, fun game. That was donated to us by Toys R Us, so we're very grateful to them. Okay, we are a very interactive show. We encourage all of your comments, input, and especially in this hour, I know you have questions about anxiety for Dr. Granpeesheh. Want to remind you that there are many different ways to interact with the show. Emily's going to show you some of those different ways on the screen. I will once again remind you that if you go to www.autism-live.com, you can not only watch the live show there, it plays on the computer screen, just click the little arrow that's there, or you can watch recently recorded live shows there. And there is a lovely long skinny white box next to that screen. Put your cursor there, type whatever you would like, hit enter, and it shows up here on my screen with about a 1 to 2 minute delay, making it very efficient for us to be having a conversation in almost real time. That's free to you. You don't have to log in. No one is taking your information. You don't have to put a credit card in. How convenient could that be? And we appreciate appreciate you participating in that. You have the ability to participate on our Facebook page. We hope if you go there, you will like us there, share our page with other people, and register for the free newsletter that comes out on the first of every month. So lots of different ways to participate. We hope that you will. I don't want to take any more time because we want to get right to anxiety. So it is time for Ask Dr. Doreen.
Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Welcome to Ask Dr. Doreen. As I stumble over your name, I know who you are. Dr. Doreen Granpeesheh is here with us. So thrilled to have you here this morning.
Thank you. It's
always on a Wednesday, thrilled to have you, but especially today. So many of you have been asking for Dr. Doreen to talk about anxiety, and this is a subject that you know a great deal about, and especially when we pair this with autism. I think anxiety to begin with can be overwhelming, but then when we have that element of autism, it can be overwhelming to all of us. And you are indeed an expert in autism, having worked in this field for multiple decades. I never like to give away how many decades. And as I always like to remind everybody, you're a visionary in the field of autism.
Thank you. You're too kind to me, Shannon.
No.
You always embarrass me on Wednesdays.
Not at all. Because you do see our kids and the individuals on the spectrum as whole people. And you have a very far-reaching ability to see the kinds of things that they need. So today you're going to be talking about anxiety. We always like to give a disclaimer at the start of the show that no one on the show can ever give child-specific advice. We're encouraging people to write in with questions, but we don't give child-specific advice. Do you want to address that really quick while I'm going to link up your iPad?
Sure, go ahead. Yeah, we don't, and especially today, I mean, we're going to be talking about anxiety and about obsessive compulsive behaviors. And, you know, the main reason we're doing this presentation is because I, over the years, have really felt that there's a big overlap with autism, and that a lot of kids with autism do experience similar symptoms. And therefore, you know, obviously we've learned a lot about the treatment of anxiety just from people who have anxiety. And so therefore, some of those approaches would also apply to our kids. The fact that a child might have autism doesn't mean that they can't have anxiety. It doesn't mean that they can't have obsessive compulsive disorder. So we're going to talk about those two main things, and then you know, some interesting treatments and those types of things.
And in looking at the material, we see that there is information here that covers multiple weeks. So we're not going to get it all done today.
Yeah, it was hard for me when I was putting this together. I mean, people who've heard me speak know that I tend to go over my time.
We have a lot to say.
Especially about autism. It's just, there's so much to talk about. But with, you know, and I really did cut it short as I could, but then at the end of the talk I realized, oh my gosh, it's like, I don't know, 40, 30 something slides. And instead of rushing through, I think that it might be better to do two talks. So today maybe we'll go through the first half and talk about sort of a lot of the comorbidities and how you see anxiety in both. We'll see how far we go today.
Okay.
And then maybe we can focus a little bit more on treatment aspects and so on next week.
Okay.
So we'll just keep it going and see how long it goes.
And we encourage people to be writing in your questions. We will leave some time for questions at the end, but some of your questions may be addressed as Dr. Granpeesheh speaks. So I'm going to let you start, and I'm going to try to listen and unobtrusively take notes.
Sure, sounds good. And then also, you know, slow me down, or because we do want to give people the opportunity to ask questions in between as well.
Absolutely.
So hopefully everybody can see the screen right now, which has the talk on there. We're going to be talking about anxiety and obsessive compulsive disorder, which now has a new name, and comorbidities that they have. In other words, similarities that they have or commonalities that they have with autism spectrum disorders. So as I've said before on this show, in May of this year, we had the new diagnostic manual come out, right? DSM-5, Diagnostic and Statistical Manual of Mental Disorders, number 5. And up till May, we had the DSM-4, and the DSM-4 was, very straightforward in terms of how we defined anxiety. So I've kind of put that on the screen first because I want people to be able to see that in DSM-4, what we had was basically, 7 disorders that were listed under the heading of anxiety. There was a chapter called basically anxiety disorders, and they were listed as panic disorder, separation anxiety disorder, specific phobias or fears, social phobia, obsessive compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. And that had been that way for many, many years. I mean, I don't even remember the first time I was trained on that, maybe 20 years ago. I don't think there's been a change in the anxiety chapters for a long time. This year now, with the DSM-5, there's been a huge change. So in general, there have been more changes to the DSM-5 than any other DSM, I think. Like this year, they really have changed a lot of things. So what I did was I went through 2 chapters. That's why this presentation is a little bit longer, because we're going to talk about the chapter on anxiety very briefly. And what they've done is they've taken obsessive compulsive disorder, because it is so important and it is becoming so prevalent, that they've given it its own chapter. And it is now called Obsessive Compulsive and Related Disorders. So I'm guessing pretty soon we'll be calling it OCRD. And it has its own subtypes and its own features, and so it has been separated. They have now also separated and given its own chapter the post-traumatic stress disorder and similar types of trauma-related disorders. And actually, I don't think I have any slides on this at the end of the talk, but I will briefly mention a couple of disorders that are listed under the PTSD, the trauma-related section, because you'll find them very, very interesting. So right now, what we're going to do is we're just going to briefly look at what is considered anxiety in the DSM-5. And the reason I say briefly is because even after we go through the anxiety chapter, it's repeated multiple times, first in the anxiety chapter and then in the obsessive compulsive and related disorders chapter, that there is a huge overlap or comorbidity between obsessive compulsive behavior and anxiety. So let's repeat that again, because that is the critical aspect of how we are defining and seeing anxiety. I'm going to talk about that a few times. When you obsessive compulsive disorder, essentially, once we get into that, you'll see, but it consists of obsessions or thoughts and compulsions or behaviors that help reduce those obsessions. And the obsessions are usually very, very similar to anxiety. So they're like the same type of stuff that happens when you have anxiety. And that's why it was classified as one of the anxiety disorders. So right now in anxiety disorders, and I'm going to go through these because some of these might sound similar to things that your kids are experiencing. We have separation anxiety disorder. Obviously, a lot of our kids have a hard time with separation from the parent. Selective mutism. Selective mutism is when the child chooses not to speak. It is not the same as autism. I don't want people to go through and think that I wonder if my child is choosing not to speak. With selective mutism, it's usually the child has been speaking for quite a while, and it's environmental. So it's specific to some environments. Like the child will just not say anything at school. And it really has a lot to do with their fear or anxiety of the environment. And then we have specific phobias. Specific phobias are obviously fears of various things. I have had many children who've gone through like different fears, so initially they'll be afraid of, let's say, water, and then they'll be afraid of the dark, and then they'll be afraid of various other things. And specific phobias are really very easy to get through, but they are kind of common in our kids, and you do see some of that. And then you have social anxiety disorder, which is Obviously, just by the name, you can tell that this is something that's pretty familiar to our kids. So this is where the child feels very anxious in social settings, doesn't want to approach social situations. And quite honestly, Shannon, this is one where you could say that a lot of people in general have social anxiety disorder, where you don't really want to go to social settings because it makes you very nervous. Now, as I'm saying this, it occurs to me that I should make one thing clear, which is nothing is considered a disorder unless it impacts your daily life in a negative way. I mean, there's a very specific definition of this. And basically, I've used this example in the past where I've said, I could go home and drink a bottle of vodka every night, and as long as I was good to my family and went to work and was a responsible adult, I would not be considered to have alcohol disorder or any kind of alcoholism. So this is very important because some of us have social anxiety. A lot of people have social anxiety, but whether or not it comes to the point where you can call it a disorder has more to do with things like you're so anxious that you will not go out at all, and you begin to sort of stay at home more and avoid a lot of situations of life, and then of course that'll turn into, let's say, agoraphobia, where you're just completely afraid of going out. Or, as you can see from social anxiety disorder, it goes to panic disorders, the next one. And a lot of people will say, I've had a panic attack. And you might have had a panic attack, I don't know, maybe 5 times in your life. But people who have panic disorder very regularly suffer from panic attacks. And it is you actually see physiological changes, heart palpitation, and a lot of symptoms that indicate they're experiencing pretty severe anxiety. And of course, agoraphobia, as I mentioned, is the fear of leaving your home or going out, and that's a very common type of phobia. And it's becoming worse and worse, and it is very much related to anxiety. And then we have generalized anxiety disorder, and generalized anxiety disorder essentially means that there are more than one situation that cause you have a generally high level of anxiety on an ongoing basis. There's a lot of people with generalized anxiety disorder. This one is the hardest to diagnose because it is you kind of come to know the person as that, and you don't identify that they're more anxious in one environment or another because they're just generally always anxious. And what's interesting is the last 4 are a series that are have been added to a lot of the new chapters in the DSM, and all of it shows how our thinking has changed. So the next one is substance or medication-induced anxiety disorder. And that means that you might be taking medications that are causing you anxiety. And when I start to talk about autism a little bit more, you'll see that is one of the points that I brought up, is that we don't realize that there are a ton of medications that our kids take that actually can cause anxiety. Not even just medications. If you think about it, our kids sometimes are taking, let's say, vitamin B. Niacin, which is a form of vitamin B, gives you sort of a little rush. That's the vitamin that gives you makes you all tingle.
It's a flush sometimes.
It's a flush, exactly. Yeah. And that, for little kids, can provoke anxiety.
Sure.
So there's a lot of medication that can sort of induce the symptoms of anxiety. Then the next one is anxiety disorder due to other medical condition, which is awesome that they have this in here now, because as we go into talking more about autism, I'll mention several different things that actually cause anxiety or other types of problems and disorders. One example being if you don't sleep. If you have a sleep disorder, you are going to be anxious during the day. It's simply that. If you have any kind of, if an adult, for instance, has any kind of other addiction, it's going to result in anxiety. So there's a lot of other medical conditions that will lead to anxiety. And then they have the 2 last categories, other specified anxiety disorder, in other words, an anxiety reaction to some specific thing, or unspecified anxiety disorder. And those last four have been added to all the new chapters. So when we go into obsessive compulsive behavior or disorder, you'll see the same sort of substance-induced OCD, and OCD due to other medical conditions. So it's kind of like it shows the I guess the open-mindedness of the new DSM-5 in terms of everything that we suffer, of course we're whole human beings, is kind of interrelated. One thing causes the other, and so you could have other medical conditions that are causing your problems. These could be causing other issues, and so on. So that's just what we're trying to say in the DSM, is that a lot of what goes on is related to each other.
To me, it seems like a very common sense approach to it. I mean,
absolutely.
As parents of kids on the autism spectrum, we know our anxiety level goes up just from our child having a diagnosis. And I think of friends who've been diagnosed with cancer,
right,
and they not only have to deal with the cancer, but they have to deal with all the anxiety that comes with
right,
all the things that are going on. It makes sense.
That's exactly right. And if you think about it, that's a great example, because I would say that, something like, for instance, other specified anxiety disorder could be something that is, induced by having a child who is ill or has a disorder or something like that. And then that would be classified as other specified anxiety disorder, unless it caused you panic attacks, in which case it would be specified as panic disorder, or so on and so forth. So what I'm trying to say is there's a lot of overlap. And one person could go from having, let's say, separation anxiety disorder to agoraphobia or to panic, and so could overlap on more than one of the ones listed here.
Okay.
Now we're going to talk about sort of what do they have in common. What is anxiety all about, really? Anxiety disorders in general are disorders that share excessive fear and anxiety. Okay, so they all have a component of fear and anxiety. Fear is defined as the emotional response to real or perceived imminent threat. Anxiety is the anticipation of future threat. Now, there isn't really much of a difference there. I mean, if you have an emotional response to real threat or imminent threat, it's very close to being fearful of the anticipation of future. Anxiety just kind of lengthens the time frame. In other words, fear is sort of what happens after, just before an event is about to happen, or just before you think an event is about to happen that's scary. And anxiety is worrying about it for a long time.
Makes sense.
It's really that clear. So, and anxiety is usually about real life events. And I'm going to put this in there because you'll see the differentiation a little bit later. So it's important to identify that it doesn't necessarily have to be actual threat that's coming your way, but it is not imagined or fantasy. What anxiety is usually about something that we think is going to happen, and it's possible that it could happen. It's real life. It's not like Martians are going to come and take me. Okay. Although, who knows if that's real? So I'm very open-minded.
Good point.
So, and the most important of all is to say again that there's great overlap between anxiety disorders and this new category or new chapter called obsessive compulsive and related disorders. In fact, there's a 76% comorbidity. That means that 2/3 of people who have anxiety have the other or the other way around. There's a huge comorbidity. So really the only reason that I can imagine that they took OCD out of the anxiety chapters is that it is such an important disorder that it needed to have its own heading and its own chapter, and we will go into that in a minute. Okay. The difference is that obsessive compulsive disorder is usually somewhat irrational. It's somewhat more fantasy type related, or stuff that, most people would say, this isn't real. It can't. So the thing that you're imagining, for instance, being covered with germs, okay, is irrational. You have not been exposed to germs, and you have an irrational belief that you are covered in germs, or you have an irrational belief that some other thing is going to occur, and that's what you're obsessing about. So there's a slight difference there, that anxiety is usually real life situations, and OCD has to do with more things that are a little bit less rational. Although, having said that, I think the next time the DSM comes, they're probably going to remove that distinction, because I can think of a lot of people I know with anxiety where their fear becomes pretty irrational. But I think what they're trying to do is they're trying to make us understand that, and this is how I see it. Like, when you have a very, very high level of anxiety or worry or fear about something, it will ultimately lead to other things. It'll either cause you to do compulsive behaviors, which is OCD, or it'll lead to physiological things like panic attacks, or it'll lead to avoidance completely, which is like agoraphobia. It leads to some sort of behavior or defense or physiological response because it's so overwhelming to the individual who's experiencing the fear that it perpetuates. That makes sense.
Makes great sense to me.
Okay, so the next slide, we are now going to start actually talking a little bit about obsessive compulsive and related disorders, and then I'll show you what they are, and then we'll maybe see if there are any questions we need to answer, or we can keep going. So as I said, the new chapter, now we're going to really focus more on this section, because this is where it relates to autism. It's called obsessive compulsive and related disorders. So I wonder if they're going to change us now from OCD to OCRD. Very likely, because ADD became ADHD, if you remember.
Yes.
So the obsessive compulsive disorders are characterized by the presence of obsessions and compulsions. Okay. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to obsessions. Okay, so many, many examples. I'm afraid that I'm dirty, I will wash my hands 100 times. I'm afraid that I left the fire on, the stove on, I'm going to go and check it 100 times. But I highlighted the word repetitive behaviors because this is where you start to see some of the similarities with autism, in that it's, in fact, I love the DSM for this, but when you start looking at the obsessive compulsive chapter, there is a page and a half about the similarity to autism now. Good. And there's a lot about how the behaviors are similar yet different, and how you can try to differentiate, but that there is a huge, huge overlap. And people are beginning to understand that there is a very big component of OCD within autism. It's not listed there, it doesn't say it's there, because the way that the DSM functions, it's sort of like, I've said this before, when something is a little bit more pervasive and could lead to a multitude of symptoms, you go with that label. It's kind of like saying someone has pneumonia. So if you have pneumonia, obviously you're going to have a cough and difficulty breathing and possibly a fever and so on. But you're not going to get a diagnosis of, let's say, pneumonia and bronchitis, because pneumonia is kind of more overriding than bronchitis. And with autism, the expectation is that it is more pervasive and that it will influence and affect the child in a multitude of ways. So, people don't go into identifying the other types of illnesses or problems or disorders that the child or individual might be experiencing. And I actually think it's very important to do that, because first of all, funding agencies sort of depend on knowing that. It's one thing to say a child has autism. It's another thing to say the child has autism as well as anxiety or OCRD, as well as, let's say, panic attacks or disorder, or selective mutism. That's a great example. If I have selective mutism going on, it's going to require a lot more work. Right. And so these things are actually important to add on and not to be considered part of the autism diagnosis. I'm going to go into that more.
Because we don't want to just assume and say, well, because restrictive and repetitive behaviors are part of autism, I know that sometimes people just accept and go, well, that's autism, as if there's nothing we can do about it.
Exactly.
And that is false.
That is false. I mean, it's not that it's false. It is definitely a part of autism. It's one of the symptom criteria that leads to the diagnosis of autism. But just like anything else, it is treatable. Just like anything else. I mean, we look at these disorders like obsessive compulsive, and I'm going to talk about the treatments. Well, clearly with autism, it's the same thing. And the way to treat any disorder is to break it up, you know, and look at its individual symptoms and try to deal with the individual symptoms. Now, there are some where we don't know very well how to control them without medication, like let's say schizophrenia. But nevertheless, schizophrenia, of course, the best treatment is still medication as well as therapy.
Okay.
So, and that's always the case. Pretty much anything I've ever studied, the best treatment is the combination of medication and some sort of treatment, therapeutic treatment. We're going to talk about how to treat some of these and the medications that help as well.
Would you like to take a break?
I think I'm going to just see. Sure. If there's, yeah.
Okay.
Let's take a few
Let's take a
minutes.
short break because I don't want to work you into the ground.
Okay.
This is a lot of information, so we're going to take a short pause, and we'll be back more with Dr. Doreen Granpeesheh. This is the Anxiety Show. Stick with us.
Hello, fellow activists. In our last segment, we talked about step number 2, educate yourself. Step number 3 is get support. Now, any journey can feel overwhelming if you feel like you're walking it alone. Well, you're far from alone, because with 1 in 50 kids diagnosed with autism today, there are a lot of us out there. Of course, there's always the issue of financial support. Now, there's a handful of organizations out there that offer financial support to families in need. ACT Today, or Autism Care and Treatment Today, is one of them. Visit our website at www.act-today.org to find out more about our grant process. I want to talk about a different kind of support today, emotional support. Now, you can get that from other travelers on this path. Some of the best advice I've ever received is from the moms of other kids with autism who went to school with Wyatt or were involved with programs with him. Then there are the pioneers. These are the families that have gone through this years ago, and there was very little information out there. All of these people seem to have the desire to pay it forward. Now, one of them, Lisa Ackerman, who is one of my mentors, started an organization called TACA, Talk About Curing Autism. She actually took the concept of mentors and support groups and made it available to everybody. You can go to their website, talkaboutcuringautism.org, to find out more. During the first and most difficult year after Wyatt's diagnosis, I wrote an email to close family and friends, letting them know what was going on and the challenges our family was facing, and why we dropped out of sight. I was amazed at the outpouring of love and affection and all the help I received from that email. First, you have to be vulnerable. You can't be afraid to ask. Try this out. Could you cook me a meal? Are you going to the market? Can you pick me up a few things? Could your kids play with my kid and make them feel included? Or can you come over and clean my house? Well, maybe not that last one, except with your best friend. And maybe the best support of all is having someone that listens, and that doesn't cost a dime. So until next time, surround yourself with the loving kindness of others and keep the faith.
Welcome back to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, and this is the much requested show, the Anxiety Show. We should say it's the first, because we're planning on this taking more than one show, because we want to take our time. This is a very important topic, as you were saying, because it so affects our community.
Right.
And I think primarily we're really interested in knowing about how this affects our kids, but the secondary is that it affects the parents as well.
Oh, absolutely, yes. Our parents have a lot of anxiety, generally.
I can speak to that.
Yeah. No, it's not.
So-
it's not hard to develop anxiety symptoms when you have a child you're worrying about all the time.
And knowledge is power, and understanding how these symptoms come about and what to do about them is a powerful, powerful thing. So Dr. Granpeesheh is here today talking about this with us, empowering us. We thank you for that. We went through some of the differences between the DSM-4 and the DSM-5 and how these things are categorized. So where would you like to pick it up now?
We're going to talk, now we're going to just continue and talk a little bit about the obsessive, compulsive, and related disorders. And then I will just start going into how they relate to autism as a whole.
Great.
So,
We need to tap the screen here.
Oh, okay.
Okay, there we go.
Okay. So the obsessive compulsive and related disorders are listed below, and I highlighted in red the ones that I find to be very commonly seen in ASD. For instance, and we'll go through them, obsessive compulsive disorder, which I will go further into. Essentially, as I said, obsessive compulsive disorder is, having obsessive thoughts about something and then doing compulsive behaviors to try to reduce those thoughts. Body dysmorphic disorder is one where you actually have different, you obsess about various aspects of your body. Okay, very simple.
Could result in anorexia, or
it could absolutely result and develop into anorexia or other types of people who, for instance, have a lot of plastic surgery or various other things.
Okay.
Hoarding disorder is where you carry around or you hoard objects. So in other words, I mean, we've all now seen these shows about hoarders and people who will not throw things away and they will keep them. And what the general public doesn't realize is that this is actually a form of anxiety, because it shows that the individual is so afraid that they are trying to sort of, surround themselves with things they own that will help them feel safer. It's always an obsessive thought, a fear related thought, and then a behavior which helps reduce the fear. And in hoarders, it's keeping things around them. Now, I've highlighted that because I know a lot of my children will carry objects, so they will, for instance, you'll see that they'll have a couple of objects that they carry together, and a lot of my kids will have like a little drawer or a little place where they put all their stuff, and they don't let anyone touch it because it's my stuff. And it's, or very basic form of this is carrying around your blanket all the time, and it's not really hoarding, but it's the same concept as this object is necessary for me to not feel anxious.
And going back to what you were saying about the panic, all the things under the anxiety, someone might be listening to this and think, okay, well, my garage is a mess. Mm-hmm. But that's different than, it has to get to the place where it's disabling to your life.
It's extremely disabling, yes. It's not really... I mean, we have opinions about who throws enough away or doesn't throw. There are some people who throw everything away, other people who don't throw anything away, but hoarders... Again, it becomes debilitating.
It's another level.
Right, okay. Absolutely.
With all of these things, it has to be at a certain level that it's preventing you from leading the life that you could lead.
Exactly.
In order for it to be classified as a disorder.
That's correct. And then we have trichotillomania, and trichotillomania is pulling out hair. And, I knew someone actually who had trichotillomania, and they were constantly, it was a man, and they were constantly pulling out hair from their beard. And it's an anxiety type of habit, and it's just, you're just pulling out hair. I don't know if you've ever seen that.
Yes, it's a very interesting disorder.
It is. And it's as you notice, the commonality with all of these is, the obsessive or the anxiety feeling and then the repetitive behavior. Remember, that's how we defined it. It's always an anxiety feeling and then the repetitive behavior. So it's kind of interesting. Excoriation disorder is picking skin when you're anxious. And as you know, a lot of our kids do this, so I actually highlighted that as well. And so it's important to note that when you see these things, start thinking about, well, what does it mean if your child is actually from anxiety, for instance, picking skin? Now, this is different from, let's say, a child who might have a injury. Right. If you have an injury, it's very common for us to try to pick the skin. That everybody does that. I did that when I burned my hand. Mm-hmm. But that's not the same thing. And here we're talking about people that if you have excoriation disorder, or if you've seen someone with this, you know what I'm talking about, because it gets to be very, very difficult to control.
Yes.
And this is really just because it's a repetitive behavior. And it's, as I said before, somewhat irrational. Mm-hmm. But it is something that you do, and unless you do it, you're going to feel anxious.
Yeah.
Okay. Then we have, of course, substance and medication-induced OCRD, or obsessive-compulsive related disorder. And I'm going to go more into when I talk about autism, but there are a number of medications that can be increasing the anxiety that our kids experience.
Would pandas come in to play, or is that an entirely different thing?
Very different thing.
Okay.
PANDAS is sort of the pediatric autoimmune neurological disorder associated with strep, PANDAS. And that is a series of kind of problems and issues and delays that come about if you have had strep infection at some point, and it has led to an autoimmune reaction, which has led to neurological problems.
Okay.
And that is, one of the subsets of autism, and it's easy to diagnose actually because. First of all, it's surprising. You'd be shocked how many people don't even know if their child had exposure to strep. You don't necessarily have to have seen the symptoms of strep. So a strep titer is done to identify that. But the second thing is that usually with kids who have PANDAS, it was a sudden decline. So it was kind of like the child was progressing, and then at some point there was a sudden drop. And it doesn't have to be the early years. It could be later as well.
Okay.
So that's a little bit different. But substance and medication-induced stuff is like you're taking, let's say, medication for ADHD, and that will automatically cause some level of anxiety because it's an amphetamine.
Okay.
So, you eat mass quantities of chocolate or red dye, substance-induced.
Okay.
So a lot of the stuff that we eat in our food could be increasing our anxiety levels as well.
Interesting. All right.
Yeah, that's where
Very
the dietary
interesting.
stuff comes in.
Yeah.
Other specified and then unspecified. Now, as I said, that's pretty much in every chapter now. But what I liked about the unspecified obsessive, compulsive, and related disorders was that they listed a few, and one of them was body-focused repetitive behavior disorder.
Wow.
Body-focused repetitive behavior disorder. So we're talking about...
We both automatically start to rock.
Right, so we're talking about certain repetitive behaviors that are just within our body. Now, this is fascinating to me because, and I'm so glad I came into the field of psychology because I should have been nowhere else. Like I'm telling you, when I pull up the DSM, and I start making presentations about other stuff, and I am in there for 6 hours. Like I just don't even want to leave. This is very interesting because I remember I have known people who are not at all on the spectrum of autism, and in fact extremely intelligent people, and not at all in any way hearing impaired or anything else that could lead to this kind of body rocking, but they do when they're anxious literally body rock.
Yeah.
So there are people who do literally do that just from anxiety. In our kids you might see that, you might see a lot of and it's funny because with our kids, anxiety and excitement are very difficult to differentiate, obviously, and so when you see our kids very excited, they'll do this as well.
Right.
And if with little children in general, not just kids on the ASD spectrum, but just little kids in general, they'll jump up and down if they're excited as well as if they're anxious, like when you're fearful and so on. So the commonalities between the obsessive compulsive disorders are that here's some different aspects of them. So there's the commonality, as I said, there's some obsession and then there's a compulsion. So these are the different types. A cleaning OCD, which means there's contamination obsession and then cleaning compulsion. A symmetry type of OCD. So that means there's an obsession about things not being in perfect order, symmetry, and then there's a repeating or ordering compulsion, and that's the one that you see the most in ASD, where I think we even had some questions on this, where you see a child will put things in a particular order, lining up objects, their toys and so on, or items, and getting very, very upset if you change the order of the objects or if you destroy the line. So this is actually a very common thing, and it's not just in putting things, not just in tangible order, but it can be stuff like there's no symmetry because you're taking me to school from a whole different direction that we usually go. There's no order. Doesn't make sense because we've never done this before. So change.
And inflexibility.
Inflexibility. That's exactly the word. It has to be this way. It's the things have to follow a particular sequence, and if they don't, it's the end of the world.
We actually have a question having to do with this. Do we want to wait for that towards the end?
Sure, we can throw it in right here.
Hi, Shannon and Dr. Doreen. Thank you so much for discussing a very important topic. My daughter is 8 and was diagnosed with autism when she was 3. She likes to keep things in their places, like toys and bags. She also likes to close open doors and zip up bags. She gets upset if we change the places of the toys or backpacks and insists on putting them back. If the bathroom door was open, she runs to close it and gets frustrated and bites her hands if we try to block her. What is the best way to manage these behaviors? And we appreciate Dr. Doreen's feedback in advance.
So we're going to talk a little bit about how to treat these behaviors later, probably more next week, so please stay tuned with us, because if I jump into that, I'm going to kind of go heavily into the...
Absolutely.
But the thing is that, I want people to think about it this way. Like, if someone is blind, okay? If someone does not have the ability to see, they will... how do they manage in their home? They place things in a particular place, and they don't want things moved. And the reason for that is so that they know where things are, right? Because they can't see them. So they know where things are, so they can depend on things being where they left them. And that's how they function in the world.
Right.
Okay.
It's a great coping mechanism.
It's the only way that they can cope. Exactly. So now think about it from an autistic person's perspective. Things are placed in a particular way because they receive. Now it's more irrational, obviously, because you can see as well to some extent, and who knows how well our kids actually have visual skills, but some of our kids. But it gives you a sense of control. Having things in a certain order removes completely the surprise element. There is no surprise involved. So with your child here, there's no surprise, and she wants, and everything that this parent listed has gone to an irrational level or to an excessive level. But if you reduce it, then you can see how it developed. It's like, okay, so what were they? She places things in an order, I think.
She likes to keep things in their places, like toys and bags.
Right.
She also likes
so that she knows where they are.
Right. She likes to close open doors.
Right, because that gives her a sense of safety. Now, keep in mind, we're always talking about behaviors that reduce fear, reduce anxiety.
And zip up bags.
Yeah, so that they remain orderly or clean or whatever.
She gets upset if we change the places of the toys or backpacks and insists on putting them back.
And then she gets all worked up and bites her hand and so on. And as I've said multiple times, biting and those types of behaviors is simply communication. She's trying to say, don't do this. It upsets me when you change the order of things. And I don't want anything changed because this is the only way I feel safe in the world. Very simple. So you understand the cause, you understand what's making her feel that way, but you don't want to really reward the fact that she's biting her hand every time. So that still means you behaviorally intervene, and you don't necessarily stop doing what you're doing every time she bites her hand, because then you would be rewarding the hand biting. But it's always important to understand the reason. Remember, we talk about the function. One of the things we're writing a book right now, and I kind of want to be brave and write a new thing about how we talk about the function of things being, the function of behaviors are always like to avoid something or to gain access to something. And one of those key things in my mind is to avoid or reduce anxiety.
Absolutely.
A lot of what we do in our world is just to avoid anxiety. A lot of what we do, honestly. If you think about it, something as simple as alcohol. Drinking alcohol has to do just simply with reduction of anxiety. That's all it is. What do they say? It reduces inhibitions, which means it reduces fear. So, and because I'm one of those people that believes life is about fear, like overcoming your fears, that's why we do all the different things we do. Now, with this child, it would be important the reason it's important to know why the behaviors are occurring due to anxiety is because then you can help the child overcome the anxiety. And that's where you focus your attention, is doing things that will help the child overcome the anxiety. And there are many things you can do, medications being one, and we'll go into some other cognitive behavioral treatments as well.
Okay.
So now with the OCRDs, the other two, forbidden or taboo thoughts and harming self or obsession about harming others, is stuff that we don't very commonly see in our kids. So I'm just going to try to skip over those and keep going. Okay.
Okay. Do you want to take a break?
No,
Okay.
I'm going to keep going because we don't have very much time left.
That's
and then
true.
next week we'll go heavily into the relationships. Let's just see where we are now.
Okay.
So one of the really important things, I know a lot of people will ask this question, is that, you know, when you look at first-degree relatives of an individual who has obsessive-compulsive behavior or disorder, so that means, you know, first-degree relatives, so child-parent type relationship, is the rate of obsessive-compulsive related disorders is double in first-degree relatives. So in other words, if you have obsessive-compulsive related disorders and I don't, okay, that's the normal relationship, but you know, your child might have twice as much the likelihood of having obsessive-compulsive related disorders. Now here's the second point, which is more important. If you had obsessive-compulsive disorder as a child, then the likelihood that your children will have it is 10 times as much.
Wow.
Yeah. So that I found to be very interesting because, you know, it is something to think about.
It absolutely is something to think about.
And and we don't know right now, you know, it's under the heading of genetic components, but you don't really know if that's true, because I was thinking about this, and if you as a child have obsessive compulsive disorder yourself, the question really is if you've gained control over that as you become an adult, because if you haven't, then it's possible that you would your anxiety would then kind of affect your child's or your family members. So that's another, it's sort of a behavioral or environmental component of it as well.
I absolutely, you know, I've shared before on the show that I have some of these things that we're talking about.
Yes.
I certainly have battled anxiety and OCD, and like a lot of moms on who have children on the autism spectrum, I fully, you know, go, yep, I have some of these things. And it wasn't until my son had autism that it got to a rate where I needed to seek out help. I didn't seek out help until I saw my son starting to engage in some of the behaviors that I did. And that was when I got my wake-up call, and I said, okay, this is not okay.
Yep.
I have to get help for this, because otherwise I will have changed the way he looks at the world, and I just refused to do that. It was hard, but I got help.
Yeah, that's exactly right. It's so sad when you see, I go back and I think of some of my patients and also some people that I've known, patients outside of ASD, and it is really, really sad. I mean, it's pretty debilitating. I remember, first of all, I remember someone I knew who had their OCD had become extremely severe, and it had turned into agoraphobia. They would not leave the house, and when you went to visit, she had you know, gloves on, plastic gloves on, and a sort of a cleaning spray and thing, and that's how she lived from the minute she woke up. And it was extremely sad, not just to see what she was going through, but how it was affecting her. I think her daughter was maybe 14 or so at the time, and it was really causing, like, even to a level of psychosis for her daughter, because her daughter was having, like, must have probably been through many years of this. And you know, it causes an ongoing fear, because you never really know when the person is going to react to you and blame you. I mean, I knew someone else who actually used to get very angry if someone had hair you know, a strand of hair that would come off because it would freak them out that it's going to fall on the floor or something.
Yeah.
OCD can be pretty severe.
Yeah.
And then I remember a mom I had who wouldn't even come to our clinic many years ago because she felt that the world was too toxic, and so we couldn't actually help to see her child because she wouldn't leave the house with her child. She wouldn't allow the child to go to school. Because not because she was worried about the child, she was worried about the child bringing germs home to her.
Right.
I mean, it can be very devastating.
Yeah. I mean, I stopped driving. I was 40 whatever years old, and I stopped driving and pretty much had said that I was never going to drive again.
That's amazing.
And I was somebody who had always been a road warrior. I'm a road warrior again. I commute a great distance to come here every morning, but I had stopped driving for over a year. And so when we came to clinics, my husband had to be present. I mean, usually that was the case anyway, but he absolutely had to be because otherwise we couldn't drive here.
That's amazing.
So, you know, I relate to a lot of these things, but quite honestly, it got exponentially worse the more we got into autism, and I saw that you know, because I was going out less and less to the point where, you know, I pretty much the only thing I was going out for was to come here to clinic. And it was a day that my son, we had to go someplace, and here he is supposed to be having a social program, and he stood there and said, I want to go home, I want to go home, I don't feel right, I want to go home, which is something that you know
understood.
I had said. I'm just keeping it real here. I had said that to my husband. I just want to go home. I don't feel good. I want to go home. I want to go home. And here my child had picked that up. So it is essential that we all, you know, it's hard. It was hard to face it. It was hard for my husband and I to face it, but because I didn't want anybody to help me with it because I didn't want to drive again.
That's right.
you know, but you know, you have to get help for yourself and you have to get help for your child.
Absolutely right. Right. That's right. And you made me think that instead of going into sort of this, I want to skip to another area where we look at anxiety in ourselves. If I'm going to leave people with anything this week, I want you to start thinking about, let me just see if I can find those slides. I want people to start thinking about anxiety in yourself, because when you understand anxiety in yourself, as you say, Shannon, you can really help to treat things and to help your child, help yourself. It's very, very important that you are able to come from that. You know, how do we define anxiety? We define anxiety as a normal reaction to stress. It starts that way, right? It helps us deal with tense situations in the office, study harder for an exam, keep focused on an important speech, whatever it might be. In general, anxiety helps coping, okay? But when it becomes excessive, there's an irrational dread of everyday situations, it becomes a disabling disorder. That's how the National Institutes kind of views anxiety. And the truth is that when you study anxiety, I remember this many years ago, there's a curve that occurs. A certain level of anxiety is extremely helpful. If you don't have that, then you become lazy, you procrastinate, you don't care, you won't go and do anything, you just don't care about stuff. So a certain level of anxiety, people who have a small level of anxiety prior to an exam will always do better. But an excessive level of anxiety just makes your behavior fail.
So there's a window we want to be in.
You definitely want to have, you definitely want to have a slight amount of the ability to have some level of anxiety, and that's kind of important. Now, see, my slides are kind of out of order here, so it's hard to find the slide that I want to look at. But I want to go to the concept of helping you to find anxiety in yourself, and I've listed some of these things. So let me find that slide. Okay, here we go. What are some of the things that you call anxiety? And this is really important. Like, when you're anxious, some people, these are different things I asked different friends and they put this up for me. So I worry, I'm afraid. How do you define, like, when you're anxious, how do you feel? This is all I asked. Well, what would you say you feel? And these are what people said. I'm afraid. I don't sleep. Now notice how common that is. That's very, very common. And when you look at your kids, and I'm going to relate this to our kids when we come back next week, so many of our kids don't sleep, and we just ignore that. Sleep is one of the biggest reasons for a million different things that our kids go through. It's one of the most important things. I don't know how we can possibly be treating our kids without considering the amount of sleep they get. It's so critical. Some people will not eat when they have anxiety. Some people will eat too much when they have anxiety. So always notice that it's always a behavior change, you know. Some people will just obsess and worry. Others will have racing thoughts. Someone said this to me, so it's kind of like you jump from one thought to the other, which is kind of interesting if you think about our kids not being able to focus.
Absolutely.
You can have heart palpitations. You can have things such as irritable bowel syndrome. So it does actually affect your GI system. You can feel dizzy. All right, these are some examples. And I just want to go through this slide as well. I know we're running over time, so I just finished this slide as well. And how do we deal with anxiety? Now, this is what's important, because you'll notice that people deal with anxiety in a million different ways. And when we come back next week, we want to talk about adaptive ways to help our children deal with anxiety instead of, you know, they could choose non-adaptive ways.
Right.
So some people will, I'll distract myself. That's what someone said to me. I will keep myself busy. Okay, I will talk to my friends or gain reassurance. Well, our kids don't do that. They can't. I pray. Our kids don't have a concept of that. But that's, praying, if you think about it, is sort of a repetitive behavior that comes out of reduction of fear. That's when people pray most, right?
Absolutely.
I take medications to help me. I exercise. That would be a very adaptive, healthy way to deal with it. I breathe, I meditate, I do yoga. So this is one of the areas that I'll talk about next week, what we can teach our kids. I practice positive self-talk. I try to change my beliefs. That's what I think more than anything else ABA helps our kids to accomplish, is that they actually start to learn that their thoughts are not rational. I try to change my beliefs. I avoid what's making me anxious. That can lead to complete avoidance, which is not good. I take drugs, alcohol, or I try to change what's causing me anxiety. So these are, you know, and whenever you see the word change in behavioral terminology, that means shaping. So next week, what we're going to be talking about is behavior change and how do we make that change occur. What I'll do next week is I'll go more into sort of what happens in autism that leads to anxiety, and then we'll talk a lot about treatment next week.
Okay. Now, point of clarification, because I didn't ask you this beforehand. I know you're going to Florida next week.
That's correct.
So will we actually be here for the show, or will it be the week after?
I'm gone all of next week now that you mention it. Thank you.
Okay. Well, I want to remind people that there are still a couple of seats. My understanding is that you can see Dr. Granpeesheh in Florida. Many of you have written into us, and I know you're excited about seeing her, but if there are more of you who are out there who are going to be in the Fort Myers area next week for Florida, you're going to want to RSVP. You can go to centerforautism.com. It's right on the front page. You need to RSVP to d.plump@centerforautism.com. So
yeah, and unfortunately, we don't, given that it's Thanksgiving tomorrow. So first of all, happy Thanksgiving to our viewers. Hope that you have a very peaceful and lovely Thanksgiving weekend. But since it's Thanksgiving, unfortunately, we won't have time to pre-record the second show, which I would have been happy to do. I leave on Sunday.
Okay.
So I'm gone all of next week, and so we will.
So it'll be the week after.
Yeah.
It'll be a 2-week pause.
Right.
But there's enough information here for us to get started on.
And we are, you know, I will do another sort of overview on the show when we come back, and we'll repeat a little bit of the stuff that we said and do a little bit broader and go into treatment and spend the whole hour on treatment.
And you guys can keep the questions coming in. We've got the ones that came in previously, but you can keep the questions in, because we'll get into more of those specific things dealing with treatment in the next week that we do. But it'll be the week after next, 2 weeks from today.
Right.
And you'll have a wonderful time in Florida.
Thank you very
and come back
much.
with good stories. We are going to take a pause now, and thank you. This was
It's a
really
pleasure.
informative. Really informative.
Well, I mean, unfortunately, we didn't get into helping people too much today, but we will.
We will get there. This has given us a form in which to think of anxiety in a different way.
Right.
And sometimes that can be, everything. So we are going to say goodbye to Dr. Granpeesheh. We're going to take a pause, go to the A Word, the ongoing documentary that's being made here at the Center for Autism and Related Disorders. And when we come back, we'll be joined by Nancy Alspaugh-Jackson. Alspaugh-Jackson for Let's Talk Autism with Shannon and Nancy. Today we're going to start. There's been a lot of controversy recently over a resignation that happened at Autism Speaks. We have stayed out of it. You're going to get both opinions here, two autism mom opinions. We'll see how we match and how we vary. And then a little later in the program, we're going to be joined by a very special guest from the Bonnie Z. Yates Law Firm talking about special education needs from the point of view of an ex-insider, somebody who's had that inside view of what it's like to work for the school, to give us the information and tools that we need to have to be successful in our dealings with the school district. It's really an exciting conversation I can't wait to have. All of that and more, but first, watch the A word.
I know a cute little blue-eyed boy, and his name is Jack. Jack Riley. He got a big, warm, blue-eyed soul that makes your heart beat fast. Exciting. I say Jack, Jack, Jack is my buddy. Jack, Jack, Jack is my buddy. Everybody around is so down with Jack.
Hi, Diana.
Hi. What are you looking at? Is this Diana?
Hi, Jack Riley. How are you?
Jack Riley has been in preschool for a few days now, with Jessica as his shadow. Today, his team meets to discuss how school is going, such as how Jack Riley's behaviors have been and how his teacher is handling him, and what they can do to help.
The first 2 days, I was kind of feeling her out because she's actually new to teaching preschool, I guess, in general. So I didn't want to make her a little bit nervous. I was telling her, it's always okay to reinforce appropriate behavior. Don't forget to do that. Yeah. So I was showing her a lot with other kids as well as him.
Looks like there's room for growth. She just seems to is trying to get into the whole hang of preschool.
But I just reminded her why I'm there, to slowly wean myself out and have you take over.
Yes. How much are you able to back off and let him kind of do his thing?
Outside play, pretty much 95%.
Awesome. It's just the play.
It's just the outside play.
The tantrums, what's evoking the tantrums?
It was snack time, because they provide the snack at school, and yesterday was bagels and cream cheese and diced pears, and he wanted neither. But instead of saying, hey, I don't want that, he started to flip out. And then I reminded him he had goldfish, he just has to use words appropriately.
Good job.
And then after that, he wanted milk, but he didn't have
You're almost done with the level.
Okay.
So he got really, really upset, and then he felt that if he screamed it louder, he would get it. So I said, no, that's because you don't have it. So I told him once, and then it still wasn't okay. I had to pull him out because the other kids were getting a little bit uneasy, so I didn't want to direct him to him. So I let him have it outside for 2-3 minutes. After he calmed down, I just told him, you don't have it. So either drink water or drink nothing. That's just what we have. Sorry, and he was fine after that.
If you're seeing that as a reoccurring thing, then we can just teach him the rule. If they don't have what you want, you say, oh, I wish they had milk, but okay, teach him the replacement thing to say, and then we'll take data on in vivo. Is he able to use the replacement behavior that we've taught?
What'd you have for snack yesterday at school? What was there? But you didn't like it. What was there? Do you remember?
Peaches. And peaches are good.
And what else?
Peaches are peaches good for me?
I love peaches. I think they're so good. And they're very good for you. They have lots of vitamins.
And what else?
I don't like them.
Yeah.
That's okay. You can just say, I don't like peaches. So you give the roll, have him practice, and then we'll take data on if he's able to implement the rule.
Should I be packing him
a juice box? And
No. I think it's good to have him kind of be okay with if it's not there, it's not there.
As much as you can fade back. Only jump in during those times where he really needs you so we can.
So if I say, tell me about a dog, and then you would have to say, a dog has fur, it has a long tail, and 4 legs. Okay? Okay? So I'm going to ask you something. Tell me 3 things about Steven.
Steven is a teacher.
He's a teacher?
He just from his bat cave.
He came from his bat cave?
And he doesn't live on the street.
And he what?
And he doesn't live on the street.
And he doesn't live on a street? Okay, I'll take it. Tell me 3 things about a kitty cat.
A kitty cat's just an animal,
It's an animal,
and it's somebody's pet.
And it's somebody's pet.
And Squally has one. And
Mommy has a dog.
No, so it's a pet, it's an animal, and
it's fat.
And it's fat? Can you say something else about it? How many legs does it have?
4.
It has 4 legs. Okay, so tell me 3 things about a cat.
A cat
You said it's
somebody's pet.
Somebody's pet?
And he has fur.
And his fur?
And he kind of has 4 legs.
And he has 4 legs! Very good. Tell me 3 things about Lainey Grace.
Lainey Grace is a baby.
She's a baby?
And she's 1 year old.
And she's 1 year old?
She's my baby.
And she's your baby?
That's your baby?
She's my sister.
She's my sister.
Okay, so all by yourself. Tell me 3 things about Lainey Grace.
Wait, let me see.
All by yourself, go.
Lainey is small and
She's
1
small.
year old.
She's 1 year old.
And she's pretty cool.
And she's pretty cool? I think she's pretty cool too.
Okay.
Welcome.
Welcome. I'm sitting here turning down my iPhone because I don't want it to be ringing while we're doing the show. Okay.
And I'll have the
Got that
bop it
done.
ring during
Yeah,
the
and
show.
I was the woman driving in front of you today, putting on her mascara, eating her apple, and only texting at the light. So, you know.
I don't think I'd be admitting that. But I want to remind everybody that every hour between now and December 20th, we're giving away something during the live show. And during this hour, it is the fabulous Hasbro Bop It.
Bop It.
Have you played with this before?
I have. It's really fun.
It is really fun. And this was donated to us by Toys R Us. We want to say thank you to Toys R Us. Somebody can win that. Make sure that as you're watching in this hour, that at some point, I don't know when, Nancy doesn't know when, a word or phrase will appear on the screen. You'll want to write down that word or phrase and email it to the address that Emily is going to show you right now. In the subject title, put Bop It.
Okay.
And then you can win this very toy, which is very fun and exciting and works on fine motor skills and fluency with fine motor skills. So very cool. There's the Bop It.
But sorry I missed the toy episode. I had bronchitis. I have been so knocked out.
It has been that. Everybody has had it, and it just takes your feet out from underneath you. But you look great.
Well, thanks. Now I feel like I just have a cold, but
you don't even sound like it.
The bronchitis is over, and I took to my bed for 7 days, which was very hard for me and traumatic for me because I just type A. I don't like that, but everything's
good for
fine.
you.
Yeah. Well,
I'm
thank
proud of you that you did it.
It required a lot of boundary setting.
Well, we're glad to have you back.
Thank you.
Glad that you're healthy again.
Thank you, and thanks to my husband for holding down the home front.
A wonderful, wonderful man.
Yeah.
So, and we've got a lot of things that we've got to cover today. There's been a controversy in the last couple of weeks that we have not had a chance to weigh in on with the Toy Festival and you being sick, and so we're going to weigh in today. You're going to get two autism moms' opinions, and we'll see where we match and where we diverge. And then a little bit later, we're bringing in Hans Gillinger, who is one of the partners at the Bonnie Z. Yates Law Firm.
Mm-hmm.
He is somebody who has extensive experience having worked with and for school districts and now is a special education attorney to give us that other side of the picture.
What's going on when you're asked to leave the room and the school officials are meeting with the advocates and what's being said? He's going to give us that perspective, which I think is so valuable. I'm dying to learn it because we're embroiled in a case with Wyatt with the Las Virgenes School District. I'm just being completely in the interest of transparency.
There you go.
And our IEP is coming up, and there may be a due process procedure. So I'm going to be very interested to hear his point of view.
And I'm always in knee deep in controversy myself. We have an emergency IEP meeting coming up on December 5th. So it's all good. We all can use this information to the benefit.
Right.
But let's jump in right away on this.
John Robeson.
And for people who don't know who John Robeson is, I would argue that among the most famous people with autism, obviously everybody knows who Temple Grandin is.
Yes.
I think a lot of young people know who Alex Plank is.
Yes.
And John Elder Robeson would probably, be right there. Those three are the most famous. He's a very accomplished author.
Yes, he is.
Very famous and well-known, multiple books.
And I believe he also, and doesn't he have a son on the
He has a son who has Asperger's. He's written a book about that, Raising Cubby, I believe on the bestseller list. And his son, we've talked about his son before on the show. There was an article written on his son and his girlfriend in the New York Times about autism and love, and now there's a documentary about this.
Okay.
And that is John Elder Robison's, son.
So why don't we start with John's, what happened with John? John basically posted, he resigned and wrote a post about why he resigned his role at Autism Speaks. And long story short, he took issue with Autism Speaks founder Suzanne Wright's op-ed piece that laid out her views on autism and what we should do about the problem, he put in parentheses. And he goes on to say he's a strong believer in science and the promise of new tools to remediate the ways autism disables us. However, he found a vast gulf between the tone of Mrs. Wright's word and her own. He went on to say he celebrates the gift autism brings us, and he also believes that most people in the autism community are aware of the dichotomy that exists. Some of us feel totally disabled, others feel totally gifted, and many he'd venture to say, feel both. But he could not help but vehemently disagree with Suzanne Wright's description of autism as a devastating problem facing our country that devastates families financially, emotionally, and in Mr. Robison's mind, really relegates this to a horrific epidemic with no upside and no really, I guess, acknowledgement of the gifts and the potential for those on the spectrum. Is that a good summation of what he...
Well, okay, because I think people walk away from it with different things. Because one of the things that I've been saying all this week is that I read it as well. And what I walked away with was that there was a culmination of events that happened that led up to her speech that then he saw... that once hearing her speech, she said, with all the culmination of all these other events, I am now forced to resign because I no longer agree with the mission. Because what I walked away from what he said was, it is clear to me that Autism Speaks is an organization for parents of kids with autism that have the more disabling aspects. And he said, I was looking for an organization that... This is what I walked away with, that I was looking for an organization that was by and for people with autism, in which case we would be very careful about what we said.
Right.
And that he had voiced that, and that he didn't feel like there was a response to it, and that it culminated in this speech.
And he does not feel that people like himself on the higher end of the spectrum have a substantial voice in the governance of Autism Speaks.
Yes, he clearly states that. I totally agree with you there. But I didn't feel like... I felt like from reading it, and I encourage all of you, it's on his blog, to go and read it. It's jerobison.blogspot.com, to read the whole thing to see what you walk away with.
I want to point out that he says that the priority cannot be autism parents or autism grandparents. To him, it's got to be the actual people with autism. So, I take that point.
And that's the organization that he's looking for to be involved in.
Right.
Now, I, as a parent of a child on the autism spectrum, and I don't know if you'll agree with me with this, that I look at Autism Speaks, and I agree with him that that's not what it is, that's just about individuals with autism. I think it is...
I agree.
It leans more towards the parents. I don't disagree with Autism Speaks' message to lean more towards the parents.
Right.
I think that maybe there's an organization that needs to be formed that does what John Elder Robison would like to do.
Another organization? Yet another organization, Shannon?
Well, I think there has to be an organization that speaks to what those individuals feel.
Well, isn't the Self-Advocacy Network that?
Well, in talking to a lot of my friends that are on the spectrum that are older, no. They don't feel like that necessarily, that they feel like that's a little more militant than where their personal beliefs are. We're going to continue talking about this, but I think, and as we go through everybody's different viewpoint, what strikes me is that how easy we all get offended. how easily we all
me
get
too,
offended.
and I want to address that.
Because I got offended by something that comes later,
Okay.
and we'll talk
I want
about
to
that.
address that.
Okay.
Now, we had from the Age of Autism, Ann Daschle wrote a response to Suzanne calling for the first ever National Policy and Action Summit. I carefully read what she said. And she said, "Dear Suzanne, I really don't see what you mean by a national plan, and I can't imagine America waking up to the autism crisis. Just what would a national plan entail? So far, when it comes to autism, no one anywhere is doing anything. Health officials at CDC and Prevention in Atlanta, who get billions of dollars, have barely noticed autism. You referred to a monumental health crisis. No one at CDC has ever called it a crisis." So then she goes on to say that it's time to talk about why there has never been a single comparison study of fully vaccinated and never vaccinated children. She brings in causation, and as most of us know, Age of Autism is very focused on vaccination as a potential trigger and or part of the causation of autism. So she goes on to say that she wants to see just what this plan looks like, and shouldn't part of our national plan also include, finally, honesty and thoroughly addressing the issue of vaccines, which she says that Bob Wright was quoted at a U.S. House Reform Committee as saying, "I'll tell you without any secret, my daughter firmly believes that vaccines were the relationship that triggered him into this pit." So she used it as a jumping off point to talk about the neglect in her mind of addressing the vaccine issue. So that's another take.
And we haven't really talked about what, in fact, Suzanne Wright said. And
Actually, I read the plan. It's quite thoughtful, and
what the letter that she wrote. I have to say, as a parent of a child on the autism spectrum, I thought it was beautifully crafted.
I did too.
And that it was very effective about saying we don't have a plan and we need to.
Yes.
And the fact that there isn't a response
and what
is
exists
shocking.
out there, and really the state of most of the families living with this.
And that there are families that are having huge issues. And I certainly looked at that and went, I totally relate.
Of course.
And there are things about it that, you know, the severity of what some people have gone through that I didn't go through. My heart bled for all those
Yes.
families. I thought what Suzanne Wright wrote was beautiful and effective, and I was happy that she was speaking for me.
I was too, with her powerful voice.
Yes.
Then there was a reaction from our friend Doug Baker, who is a financial advisor for families after having gone through raising a son with autism and reaching that cliff that we all speak of, where services stop being provided by regional centers, school districts, whatever, and so many of our children end up sitting on the couch unemployed, regardless of how high functioning they are. And he wrote, "If Autism Speaks never existed, where would autism be today?" And I urge you to read this, because basically he says that this call to action, he feels there's nothing degrading, that they have the clout and connections to pull in high-level politicians, national and global leaders. He applauds them. He does go on to sort of slam some of the other organizations, which
I gotta say, that was the thing. Out of all this, I looked at it and I said, Suzanne Wright's thing doesn't offend me. Clearly it offended John Elder Robeson, and I want to be sensitive to that.
Yes.
I loved most of what Doug had to say, but I got offended when he slammed the other organizations.
I did too. I didn't think he needed to do that, like say things like Autism Research Institute, really? Jenny McCarthy, really? Done more harm than good. The vaccine blame game.
How dismissive he was of TACA.
Yes, me too.
I have to say, I wanted to say, Doug, I
Lisa
respect
Ackerman,
you.
her gluten-free, cation-free diet, the answer to all of our problems, definitely no star power there. Well, I disagree. I think Lisa's done a lot of good. I think that TACA has mentored so many parents where there is very little mentoring to be found.
And it was sad to me because a lot of what Doug said, I agreed with, that, you know, but what I felt was each one of these organizations has had a place. Wouldn't it be nice if we all came together?
Well, that's where my point is. So let me read you my response. The first paragraph just basically summarizes what went down, so I won't read that. I go on to say, Mr. Robeson and Mrs. Wright, you are both right. I know individuals on the spectrum like Alex Plank, the founder of the website Wrong Planet, who are higher functioning than many neurotypicals of this world. But come to my offices at Act Today and look at the files from families who have received or are awaiting grants, the thousands of families. There's a different story to tell. Read the letter from the grandparents living on Social Security who want behavior therapy for their 13-year-old grandson, adopted by them after being abandoned by his parents, wanting him to be toilet trained and learn to dress himself before they die, so he can be, in their words, have less of a chance of being sexually molested in a group home. Or the single mother who works the night shift as a nurse, forced to move back into the two-bedroom house of her parents, requesting an iPad so her child, her nonverbal child, can type the words, "I love you," words she will never hear spoken. The father who wants to help his son stop the severe repetitive behavior of picking at his infected eye, which doctors will have to remove if something cannot be done. These voices deserve to be heard as well, and it's downright shameful that in a country with as much abundance as the United States of America, that they need to apply to a nonprofit for help, a nonprofit that has precious little funds to go around. As a nation, we need to become more accepting of autism and those with it, and we need a national plan to help the multitude of families that have members who are lower functioning and cannot get the care and treatment they need, as well as find the answers to the cause of this disorder and the epidemic. And let's address the elephant in the room, shall we? It's time to stop shaming the parents who believe that vaccines may have been a contributing factor, not necessarily the cause, to their child's regression into autism, with a national study conducted by a group of unbiased professionals. Until that happens, those voices will never cease to cry out in outrage. I once met with the chairman and CEO of a major entertainment conglomerate who generously agreed to run a public service announcement on autism awareness for the military family, then asked me, "Why are there so damn many of you?" meaning autism organizations, and then, "Why can't you guys come together?" Indeed, why can't we? Eleanor Roosevelt, who knew a thing or two about coming together, said the most important thing is that we work together, grow together, get to know each other, even though we recognize basic differences of thought in certain areas. Haven't we learned enough about the results of bitter bipartisanship dividing our country to know it simply doesn't work? We all have a life story to tell, a life song to sing. It's time to stop screaming over each other and come together, sing in unison, different harmonies perhaps, but one powerful choir that cannot be ignored. I live for that day, and my son's future depends upon it.
And that's beautiful. That's absolutely beautiful. And I
off my phone here because it's blinging.
If there were, the one thing that I want to add is that in this last week, when we have seen a teenager in Iowa who has been bullied for some of the behaviors that he exhibits because he has Asperger's, and when it was brought to the attention of the families in the community in a news report, over 100 parents wrote in and said he asked for it. And I feel that as autism parents, we already have so much to deal with, but this brings up for me that we have one more thing that we need to do. We need to not be those parents in Iowa who said somebody asked for it. We need to be mindful of our adults that are on the spectrum when they say to us, "This word, when you say it, hurts my feelings." And and this brought home to me that we can be doing our very best in doing all the things that we can, but if we don't listen to these adults, it will come full circle, and our children will be those adults at some point. And while I have been using the word epidemic because it's what I feel in my heart, it's a word that I feel comfortable using with the prevalence of autism, if it is hurting our adults, if that makes them feel less than, then I have to stop participating in that. And I want to encourage all of us to, instead of doing the blame game, let's take some perspective. And if some of our adults have a harder time doing that, then we know what that comes from. And we have to pull another load and take their perspective and say, if that word hurts you, if you came to me, Nancy, and said, don't use this word in conjunction with me, it hurts my feelings, I would have to say, okay, then as much as I'm used to
listen to that, I
right,
agree.
And this is what I heard from my friends on the spectrum this week, that when we say epidemic, it hurts their feelings.
What would they prefer?
Well, I don't think that they have figured that out yet.
Yeah.
And that makes it hard. That makes it really hard because it stymies our ability to get help in all the ways that we need to.
Yeah.
But we need to figure that out. And at the very least, we need to listen.
Right. My biggest concern out of all of this is that to deny that the devastation is real is simply a fantasy.
Yeah, we cannot do that. But we need to find the words to talk about that in a way that doesn't hurt the feelings of our adults.
Okay, I'm with you on that.
Okay, we're good.
We're good.
We have found a concordance. Let's let the world find it as well.
Yes.
Because we need this. We need to work together.
Yeah, well, we absolutely do. And if we don't all come together, and if we don't have some sort of plan for a national, what we all agree upon, so then we can take this national plan, so to speak, to the United States government to address this. If there's such dissension and such outrage within our own community, I think this happens with every movement, though.
Yeah. Absolutely, and I have appreciated the discourse in the last week and hearing what everybody has to say, and I think maybe it's made us all a little bit more aware and cleared the air a little bit.
Right.
I think some people have piled on Autism Speaks and said, bad, 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 and other people have piled on and said, we appreciate that you've done this, this, and this.
Yes, and I'm on that, in that category of they've done so much in terms of making autism a household name.
Absolutely.
They've done so much with legislation. Most of our insurance laws would not have been changed. I'm a direct beneficiary of that with my son getting his ABA covered through insurance. So let's not be jealous. Let's not, just because there's one group that has a lot of power, let's try to get their attention to look at some of these other issues, and let's try to find a way we can all come to the table and be heard.
Absolutely. Let's our voices together.
Yes.
All right, we're going to take a break, and when we come back, we have Hans Gillinger from the Bonnie Z. Yates Law Firm. He's an insider who used to work on the side of the school district. He's going to give us some information about what happens behind the scenes so that we can be empowered at our IEP meetings and know what's up. Okay. I love this. We'll be right back after these messages.
Hi, we're at the Toys R Us in Porter Ranch, California. And Emily and I are going to take a little tour around the store and find some great toys for some great kids.
All right, let's go.
Come with us.
Yes.
Okay, bring your dinosaur and come on, let's go look at things in the game aisle. I know you love games.
I do love.
All right. So here we are in the game aisle, Emily, and I want to show you that there's all these games that you can get for kids of all ages. They're interactive and really remarkable. One of the hot toys this year and many other years is the Bop It toy.
Okay, so what about the Bop It is so reinforcing?
Well, you know what? It can be interactive. It can be a social game. It makes lots of noises. Sometimes they light up depending on the version. It helps to work on fine motor skills, and it helps to work on fluency. This toy will grow with the child, and in fact, you can get it in different versions. This is a little bit more complex version, and up top here, we have one that's especially for older kids. It's called the Smash the Light. I would wait until a child is older to play with this one. So should we check out the Lego aisle?
Yes.
Okay, let's do it.
Go. So how can we use Legos to help our kids?
Well, they're really spectacular toys for our kids because they work on executive functions and planning. They're really colorful. You can work on colors and grouping and matching, counting, because they have the little dots on the top. And if you have a younger child, you can start with the Duplo toys that are compatible with Lego and they don't have the choking hazard.
So then as the kids get older, what's great about Legos, it looks like, is that there's all sorts of themes. We've got movies here and video games, so the kids can really connect with what's personal to them. So Legos are amazing, but what else do we have to see?
Let's look at some educational toys in the leapfrog aisle, shall we? Okay.
Okay, so what do you have here?
Well, we're in the leapfrog aisle. This particular toy, very popular this year, is a leap reader. It comes with a little pen, and it tells us that we're going to read, write, and listen, all skills that we want to work on with a child. This pen that's in this box, you can put it over different pages in the book. It will read aloud to the child. They can trace their letters. It reinforces them for doing a great job. It's a really spectacular toy for our younger kids that are working on reading, writing, and listening.
This looks like a lot of fun and a really great way to help our kids learn to read and write.
Absolutely.
What else are we going to play with today?
I think we should take a trip down the functional pretend play aisle. This is where you're going to find all the things that are like real, but the toy version. So I've got this lovely set here that's all fresh vegetables, so I'm teaching nutrition at the same time. They're all appropriately colored. I've got a knife so I can be cutting them too. This is really great play for a young child.
Shannon, I heard you got some toys that I get to play with now.
Yes, I'm going to take you to the demo table. We're going to let Emily play with some toys, and we're going to be giving some of these toys away on the show. But they're not just any toys. These are toys that are featured in this year's Toys R Us toy guide for differently abled children. And this is put together with the help of our friends at Lecotech.
So what do all these different icons mean?
These are different icons that tell us what skill this toy might help to develop in our children.
So can I play with the toys now?
Yes, it's time to play with the toys, Emily.
So I think I recognize this guy.
Yes, this is the ever popular and very sweet Elmo. But this is a very specific Elmo that teaches adaptive skills like zippering.
Almost yellow triangle zipper.
And so we get the reinforcement of Elmo talking to us when we do these things. There's a let's keep playing. So it encourages the child to continue to interact. And he's very reinforcing. When he giggles, I just want to hug him and play with him some more. Okay, so moving on, let's look at some Melissa and Doug toys. These are incredible toys. They'll last several different generations because they're made out of good quality wood.
Awesome.
And let's start with a lace and trace toy. Now, I happen to know that you love turtles,
I
Emily.
do love turtles.
And this is a set of farm animals lace and trace. And the child can pick out a color that they like for a lace.
All right.
And there are lots of different things that they can do with this. And I know it might seem like this is an old-fashioned toy, but you know, sometimes the old-fashioned toys are the best toys. Because what you're doing right now, Emily, is that you're using a lot of hand-eye coordination and you're using the pincer grasp. This is a precursor to writing right here. If you've got a child who's having difficulty holding a pencil, this is a really reinforcing way to work on this. And it comes in lots of different things. And then also for Melissa and Doug, we have this amazing switch and spin. Love this so much. This is a great cause and effect toy. As we start to put the gears together, we notice that when you turn one, another one can turn. You can rearrange this and do it in lots of different ways. There are 10 design boards, so you don't have to just do fish. There are other things that you can put there instead.
That's awesome.
Kids love this toy, and it's another Melissa and Doug toy.
Cool.
All right, let's take a look at some fun games.
So I found this game, and it's called Fibber. So Shannon, I'm going to need you to put on your fibbing glasses.
I want a fib.
All right. So this game is totally reinforcing, and it helps our kids to work on lying.
Yes, and that's something we really, I know it sounds strange, but we want to work on that because being able to tell a lie is something that helps with safety issues. And also being able to tell if somebody else is lying is a really useful life skill.
What you need to do is get rid of your cards without trying to grow your nose, kind of like Pinocchio.
Okay.
But if you get caught...
And so eventually you can have a whole string of noses attached to the end of your nose. Very colorful. Again, we can be working on the colors. Kind of hilarious. A kid's going to want to play this with mom or dad and see that mom is Pinocchio telling lots of lies. I like this game a lot.
This is a great game.
We've had a really great time at Toys R Us, and all of the toys that you see here on the table we're going to be giving away on the show. So stay tuned to find out how you can win one of these great toys.
Welcome back to Let's Talk Autism with Shannon and Nancy. We have one brief programming note. Somebody wrote in a question, is Nancy's letter in reply a public letter? They would love to share it with some friends.
Okay. It will be on our blog, Let's Act Today, which will be posted on the Act Today website. And yes, I believe that it's going out this afternoon, and then we can post it on the Autism Live website as well.
Absolutely,
okay.
We will do that, but it will be on Act Today.
Yeah, thank you.
Now, having said that, we want to shift gears a little bit because we have a wonderful guest with us here in the studio, Hans Gillinger. Welcome to the show.
Thank you, both Shannon and Nancy. I'm very honored to be here today. Thank you.
Great. And you are a partner at the Bonnie Z. Yates Law Firm, correct?
That's correct. Bonnie is my partner, and we are in the West Side and represent parents and families with disabled children.
Yeah,
well, and we're big fans.
Big fans, and we might say that Bonnie has a son, Nicholas Yates, who
Yes.
is recovered, and her own experience working with school districts and dealing with Nick's progress inspired her to take on this life role, and she's just tremendous at what she does. So.
And Nick has been on the show many times.
Okay.
Delightful young man who's changing the world.
He has.
An
We
amazing
adore him.
young man. So we're thrilled to have you.
Thank you.
And we want to talk a little bit about the kinds of things that you do at the Bonnie Z. Yates firm, because you have a very unique perspective on the way this special education law folds out. So tell us why that is.
Well, I started in parent practice out of law school in special education, and then I quickly went to institutional defense, so representing local educational agencies, mostly school districts, against parents in special education concerns, mostly due process level stuff.
So you've been both sides of the fence.
Both sides, and I can say that good is done on both sides.
Okay, good to hear.
When I hear that something was wrong and it hurt a child, you just pick up the phone and tell the director of special ed, it's because you did it this way, do it this other way from now on, and all of a sudden you've achieved systemic change. And so I think good can be done from both sides.
Okay.
But that gives you a very unusual perspective. Sure. So tell us, from having been on both sides, what 3 things should a parent know going into battle with a school district?
What 3 things?
If you could sum them up. If you
Okay,
could do
sure.
That.
I would say that you'd want to know the types of cases that school districts tend to fight, the type of cases that are often associated with settlement or some other resolution other than formal. I think it's important to demonstrate that you are a parent that understands your rights and are prepared to enforce them, and I'll talk later about how you do that. And I think that you need to have the right people in your corner to help you, because this is a very different world, special education, and you can't just be thrown into it and know what you're doing. It's important to get help.
Now, is that what types of cases that the school district will fight? Is that public record?
Yes, nothing I'm going to tell you today is revealing a client's secret or confidence, so I'll just make that clear. Just in working for school districts, I work for the 3rd largest in California and some of the smallest school districts, and so I have a sense of how institutionally they respond, and more than that, how the interaction of their attorneys, how that informs the direction they're going to go. Okay, and so knowing what the school district attorney has to accomplish, if you can weave that in to what you're proposing, then you both get to look good by your clients, and it's very likely they're going to say yes. And so it's about packaging.
Okay.
Well, and knowledge is power. So
yes,
we always say
so that's what we want to give you today.
Right, and we're going to continue to talk with you about how to really negotiate all this and be in the best possible place to be empowered. But we're going to take a break first, and if you have questions, please write them in. But we'll be right back with Hans Gillinger from the Bonnie Z. Yates Law Firm after these messages.
Hi guys, welcome back to Smarty. For November, we're going to be working on memory with our kids, and what better way than doing a scavenger hunt. The materials you'll be needing for this activity are a camera, cardstock, scissors, glue, and whatever objects you want your child to be hunting for. Step 1, you're the hunter. Find all the objects you want your child looking for and take photos of them. Now that you've collected all the objects you want your kids hunting for later, print out the images and then cut them out and glue them on a cardstock just so they're organized and isolated. Now that the scavenger hunt template is done, put all the objects back where they belong. Remember, we're working on memory, so put them in places that your kids would normally find them. You want them to be successful. We'll make this one really easy to find. Well, I hope you enjoyed this activity with your kids. Remember, the scavenger hunt is supposed to be a fun way to work on memory. Well, until next time, craft on, guys.
Can you see me flying by your side?
We're back with Let's Talk Autism with Shannon and Nancy, and we are very fortunate to have with us today Hans Gillinger from the law offices of Bonnie Z. Yates. He's giving us really an inside look at the IEP process because he's been on both sides of the fence. He's been with the school districts and is representing families now. So he's going to give us some valuable insights today. So Hans, what types of cases do the school districts decide they want to fight?
Okay, sure. There's certainly recognized categories of those types of cases. The first one is when the school district is carrying out their gatekeeping function. In other words, eligibility. Okay, that presents a proposition of a child to whom they'll have a financial obligation for some time.
Okay.
Okay, and if they can establish that the child should not be eligible, that prevents that many years worth of financial obligations. So you tend to see eligibility fights.
So if a child does not qualify,
that's right, for an IEP.
For an IEP.
Right. Any of the types of disabilities you typically associate with expensive interventions. So young kids with autism requiring home programs, that's the most expensive way to educate a child is one-on-one. And outside of the public school setting, that's just the most expensive way to do it. So you see fighting there classically. You also see as the child gets older, the fights about a district aid versus a non-public agency.
NPA, we hear that term a lot.
Right, and so you see that. You also see fights about emotional disturbance when that condition requires residential treatment, sometimes out of state. This is a very expensive, extraordinary cost. And so it's natural that they would pick to
So when a
fight
parent would like the child to be educated in a specialized autism school, would that be one of those situations?
Right. Anytime you're looking at individual instruction, you're looking at a very expensive proposition.
Okay.
If it doesn't occur at school, it's even more expensive.
Okay. So all of these things come down to the dollar sign.
They do.
If it's going to cost a certain amount of money, then it's likely to get more contentious.
That's right.
It's a reality. I mean, we don't like it. It's unpleasant. I've heard autism parents say, "Show me the dollar sign over my child's head.
That's
when
right.
you can show it to me, I'll bow to that. But until then, we're going to fight." But we understand the economic realities of it. That okay. So moving forward,
sure.
Knowing that. How we've talked a little bit before in previous shows about an IEP process and then the 504. And we're getting a lot of mail from people talking about when is it the IEP and when is it the 504. And I imagine this is part of that eligibility you were talking about.
Yes, it is. It is. And so you'll have students who are concurrently qualified for and have both an IEP and a Section 504 plan.
Can you explain a 504?
Yes, of course. Section 504 plan refers to the document that's developed pursuant to Section 504 of the Rehabilitation Act of 1973. And it guarantees essentially the same thing within the school context that the ADA does throughout this country. You qualify for the same bases of qualifying disabilities, etc. And 504 is looking at the comparison between that child and the benefits conferred to same age non-disabled peers, okay? And so the FAPE standard under 504 has to do with whether the accommodations that are provided in a 504 plan, and that's all a 504 plan can do. It can't provide services.
Okay. So it's accommodations because of a disability.
That's right.
It's a plan to provide accommodations, but my understanding is in the 504, the school doesn't pay the whatever the dollar ticket is on the accommodation, and on the IEP they do. Is that correct?
No, the school district is responsible for implementing the accommodations. Accommodations typically are not expensive.
Okay.
Some of them can be.
It might be testing in another area, that kind of thing.
Sometimes they'll call note-taking an accommodation. It arguably is a service, but I've seen it provided under 504 plan. And the test is, what do we need by way of accommodations such that as a school district we can meet this child's needs as adequately as we're meeting his same-age, typically developing peers' needs. Whereas in the IEP, it's about that child. Okay. What is required?
So it's completely about the child. In the 504, it's comparing it to what do we need to bring it up to if they were neurotypical. But in the IEP, they don't even look at that. It's what does this individual child need.
504 is a comparison between that child and typical peers. The benefit is equivalent.
Got it.
And the IEP is about the adequacy based on that child's individual needs.
Okay, that makes a big difference. All right.
The IEP confers a lot greater procedural safeguards and rights to parents and students than does the 504 plan. And so it's a better platform to contest things. You have superior rights.
Okay. Tell us about mediation. What do parents need to know about it?
Mediation is it's a different animal, and folks that haven't been to one before, I think, are surprised. Mediation is not about what your child needs or what's appropriate for your child. That was the IEP, okay? When you're at the mediation, it becomes more of a question about what does the parent want in order to be willing to dismiss the case, and is the district willing to pay that much to avoid the costs of hearing? That's a math problem. That has nothing to do with the child's needs. And so parents can be offended sometimes that the conversation doesn't seem to be involving what their child needs.
And we should back up just for a second and talk about the fact that first you go to the IEP meeting and you try to work that out.
You do.
And if you can't work it out, even with or without lawyers, then you start to file for due process. But in between, in most states, there is mandatory that they must be requested to do a mediation before you go to the expensive due process. Am I right?
Right, and actually there's a requirement that the district notice a resolution session, resolution meeting within 15 days of the date the due process hearing request is filed by the parent.
And a lot of times the mediation can be a place where where the boundaries are a little fuzzy, so you can work stuff out so you don't have to. It could be a good thing for parents as well.
You control your own destiny.
Yeah.
It's like winning out in the playoffs.
I think a lot of people are afraid of it, though. But it can be a really beneficial process, that mediation, because you can get it all out on the table and figure it out.
And you don't surrender the call to someone who may give a decision that is not really going to make either side happy.
Okay.
And so it's a way to control the resolution is such that, if it's a dollar amount, then, is it low enough that the district is willing to pay it to avoid the cost of hearing? It's really that simple.
Okay, so we start with the IEP and we try to work out what the child needs there. If it doesn't work, we're going to file due process, but we have the mediation, and then we go to due process. Now, this gets really scary to most parents. We hear this and we think, oh no, I don't want to do that. And I think the school districts sort of foster this idea of doing due process. Help us to understand from the school's perspective, in this process of the IEP and then the mediation and the due process, because sometimes it feels like to us that they're just going to roll over us, doesn't it? Doesn't it, Nancy? So what's going on for them?
Okay, so school districts are evaluating from the first instance the extent of the risk that's presented by individual parents. So parents are seen as varying degrees of risk, principally.
Isn't that interesting?
Okay, and so things that make you a more risky proposition to the school district, and therefore things that are going to make them do the things they should in the first place, are going to be demonstrating as a parent that you know what your rights are and that you are prepared to actually enforcing them.
So you're saying that's a good thing?
That's a good thing,
and
this starts early. This is as simple as making an audio recording of your IEP meeting. I've yet to see an audio recording be the key piece of evidence. that causes a case to go in favor of the parent by either a hearing officer or a court, but that doesn't mean it's not important. It demonstrates that you're aware of that right and that you're enforcing it. That suggests that you are more risky than a parent that is unaware of their rights and might very well get steamrolled without incident. Okay?
But we want to be viewed as risky. This is what I want to bring up, because it sounds like, oh, I don't want to be viewed as risky.
Yeah.
We want to be viewed as risky. We're going to get more
Sure,
of
you
what
have
our
more
child
power.
needs. Okay.
That's right.
Okay. So knowing those things is going to
so
identify.
You get into due process, right? That is a big risk factor. That shows that the parent is aware of the way that they bring about a leveraged position to get what they want. They create something in the path of the district that's unpleasant by filing for due process. It's a costly proposition and one they want to avoid, okay? And so you put the district in that position and automatically you have a value to your case. At the very least, the nuisance, the defense costs.
Right.
Okay?
It is expensive.
It is expensive. The more that you convince the school district that you have a significant issue that you're likely to prevail on, such that you will be entitled to prevailing party attorney's fees, then that shifts the calculus, and that becomes more than just defense costs. It becomes the proposition of defense and plaintiff costs, student costs, and that's when you get into settling for value. And the higher settlements are the ones where you are successful in convincing the school district that there's a pretty good chance that they're going to have to pay their own attorneys, pay you, your attorney, and pay for some significant relief.
And in each case, it's going to be a little bit different. What would make you that person, right?
And it's a fact, isn't it, that certain districts are known to be tough. Certain districts pride themselves, in fact, on having a foolproof due process system. And so when you hear that as a parent, that, oh, nobody ever wins in this district, and that this district is as hardline as it gets, where does that leave you?
In a tough spot. There are districts out there that have very well-earned reputations that they fight everything.
Tooth and nail.
That is okay for a parent, because a district that fights everything is not a district that's fighting the close calls, which are the only cases that should go to hearing, the ones that present close calls. The ones that are obvious one way or the other are going to be a slaughter, and rational decision-making when it occurs will result in settlement. If there's a case that's, a strong parent case that they belligerently fight, they do so at their own peril.
Let me ask you this to go along with that. Yeah. So I think a lot of times these school districts, and tell me if I'm accurate, that they feed on this sort of thing of let's present ourselves as we're the tough guy. I'm wondering how many of the cases they're settling, because I feel like there are test cases sometimes where they say, oh, well, here these 3 cases we won, and it sends a message to all the other parents.
That's right. And I think we can use the example of the IE funding request, okay? There's 2 ways to respond to that. Either the district funds or they file for due process to establish their own assessments are appropriate. Look at the math in that, and you would see that every time it would be cheaper to pay for the bloody assessment than it would be to establish a hearing that your own assessments are appropriate. And so there must be something else going on in the thinking. That's all parents can know, but I can tell you what is going on. They, in the cases where they fight IEs, they're making a decision to either stand up and back their assessment team, because if you give away IEs every time, it hurts morale, and it hurts the quality of the product they put out. So they have to do that for morale reasons every so often. They also have to try to avoid that image of a district that just gives IEs away without thinking it's a rubber stamp sort of
so that's
thing.
a precedent that they don't want, that it's gonna cost them more down the road. So it may not even be about your child and your circumstance. They're using you to send a message to other people sometimes. See, that ticks me off.
And it could have nothing to do with their evaluation of the extent to which they can defend their own assessments. Because if it's a decision about, we got to back our assessment team, then that's the thing you're making a decision on, not the strength of your own assessment. So sometimes the real is not the rational, and those will go through and the district will lose, but they still furthered their interest in losing.
Well, and you had a question you wanted to ask.
I had a question about other issues that might be a part of this IEP. Can safety be an issue? Can the school environment and the climate of bullying within the school, can that be an issue in an IEP?
Absolutely. Absolutely can be. Safety is, I think, the first thing that parents are concerned about when they bring their child to school and drop them off and leave them in the care of others. That's the first thing that we expect. We expect that at IKEA when we drop our kids off.
Right, so if the parent has knowledge that there has been an incident in the school's history where a child that has an IEP was put in an unsafe situation and it can be documented, that would be fair game.
Right, because typically we're looking at IEP kids being more vulnerable to those situations. And so to safeguard their well-being, it takes more, and it might take individual planning.
Okay.
Whereas to generally safeguard those on the playground or something like that, you may not need individual planning. So it's entirely appropriate and often the subject of a good
And if there's
IEP.
a climate of bullying for children on the autism spectrum, that's fair game to bring in as well.
Of course.
Absolutely.
Okay.
We are incredibly out of time. As much as we have to have you back on again because we want to know so much more. But we would be remiss if we didn't tell people about the Bonnie Z. Yates Law Firm website, which has a great deal of information. If you're someplace where you don't have access to these types of fabulous lawyers, tell them about the website and where it is that they can find it.
Sure, it's www.bonniezyates.com, and we have regular blog postings and events that we invite folks to, and informational things like this that I think are great for parents, and they often enjoy that. Now, we are accessible to everyone. We always offer a free consultation for an hour, so it doesn't matter how much money you make. You can still access our services and get a good start, if not enlist us to help you.
And I can attest to how beneficial that free consultation is.
Yes.
It is absolutely amazing. So we're out of time, but I want to say happy Thanksgiving to everybody.
Happy Thanksgiving
and
to
happy
everyone.
Hanukkah. Hanukkah starts tonight.
Yes.
And so glad that you're back. And Hans, thank you so much for being here.
Thank you so much for being with us.
We
Great
have
information.
a long break until next Tuesday. We'll be back next Tuesday and talking about the holidays and how we can make things better for our kids with lots of fun guests. Until then, please give your kiddos a hug from me.
And give yourselves a hug from me.
Bye-bye for now.
Bye.